And while today's vaccinations are good news for certain hospitals across the state, the owner of an urgent care clinic says the state should have included them in this first round as well. Our chief investigative reporter, Jeremy Finley, has actually been poring over the state's plan. So, Jeremy, you say that you found a lot of unanswered questions in this plan.
Well, that's right, Brittany. While the commissioner of the Department of Health said today that the online vaccine distribution plan by the state is robust, it doesn't offer a lot of specifics about where that vaccine is actually going to be distributed or sent. There are a lot of questions about that, especially from those who are also treating and testing people for the virus, but who will not be among the very first to receive that vaccine. They're testing the sick, wearing face masks and shields, writing prescriptions to ease the suffering. But this isn't a hospital. It's an urgent care clinic in Murray County, hit hard by the coronavirus. Here, they've already treated more than 700 COVID patients, but they aren't among the first to get the vaccine.
We're one of the only providers that are actually treating positive patients.
So where is that first round going? All the state has said is that the vaccine is being sent to 28 sites covering 74 hospitals. News 4 Investigates asked where those 74 hospitals are, but the state wouldn't say, citing security concerns that were not explained.
I've called the health department. I was told we are not in the first round.
Chandler Anderson has questions too. While he says he completely understands why hospitals need the first round, he questions why he and his peers at urgent cares aren't also included. Especially, he says, after the announcement by the health department this week that testing at state-run health departments would switch to providing self-testing kits, with in-person testing only for those without online access. Anderson says that means those needing traditional testing will have no choice but to head to places like urgent cares.
Do you know where people are getting tested? At the urgent cares, because the health department isn't open on the weekends. If we're not given this as a part of phase 1A1, then we start getting sick. Where are these people going to go? The health department's not available. All right, so we do know that this urgent care clinics will be part of the second round of when this vaccine is passed out. But again, there is no timetable on that. There is also no explanation in the state's online vaccine distribution plan that explains how they made these decisions on who was going to get it. So we have filed open records requests with the state health department trying to get specifics. How do they determine which hospitals were going to receive this and when? When we get those answers, we will be sure to pass them along to you. Lauren?
All right. Yeah, the man you spoke with brought up some serious issues. Thank you. Developing